Hi, everybody. My name is Natalie Yeadon, and I'm one of the co-founders and CEOs with Impetus Digital. At Impetus Digital, we built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools in a platform that we've helped life sciences companies from across the globe over the last 12 years do everything from virtualizing corporate meetings, events, to medical education, to advisory boards, investigator meetings, and everything in between. But more importantly, at Impetus, we really believe that everything starts with a conversation. And from these big, hairy, audacious conversations, we can move mountains, that we can work with the provocateurs, the leading edge thinkers, the digital entrepreneurs to work collectively so that we can positively disrupt healthcare. And so I'm really pleased to have somebody like that at the table with me today. And this is actually Brent Walker. Welcome, Brent. Brent is actually the Senior VP of Marketing and Analytics for a company called PatientBond. This is actually a platform that's used for digital patient engagement. He holds a BS in Business Administration from the Miami University. And prior to his current role, he co-founded his own company called C2B Solutions. This was a company that helped healthcare organizations achieve their goals through a series of consumer insights, tools, and a variety of other kind of expertise as well. C2B was acquired by PatientBond in 2017, so he's still with them. So Brent brings with him over 20 years of marketing experience in the healthcare division of Procter & Gamble, where he focused on brand building, consumer insights, customer marketing, and all sorts of other value-added solutions. So welcome, Brent. So happy to have you on the show today.
Thank you, Natalie. I really appreciate the opportunity.
Absolutely. So a really interesting trajectory about kind of where you started. So maybe you could just kind of paint the picture for all of us of being in a very interesting place right now with your current company, how you started your previous, and how you landed where you are today. So maybe just give us a quick synopsis of your career trajectory.
Sure. Yeah. Right out of school, Miami of Ohio, I started with Procter & Gamble, just about an hour south of Miami's campus, and they had a big presence on the campus. Went into brand management, and it was always in healthcare. We actually had a pharmaceuticals company that I don't think even most of the people at Procter & Gamble knew we had a pharma company. So I got a lot of experience working with doctors, with payers, with hospital systems and whatnot. I was leading the brands in both the pharmaceuticals and then the OTC medicines. And all along the way, in addition to just the kind of the classic marketing, I got exposed to a wide variety of ways of digging into the consumer psyche, understanding what motivates them, what drives them. I'll bring it up a little bit later in our conversation around something called psychographic segmentation, which is one of the secret ingredients that P&G had used. So I was there for 20 years, and as fun as it was selling Metamucil and Pepto-Bismol, and all the other wild and crazy OTC medicines there, about 2012, the Supreme Court here in the United States upheld the Obamacare, the ACA, and my business partners and I looked at each other and said, you know what, there is going to make this work, there is going to be a big call for understanding consumerisms, understanding kind of consumer motivations, how to influence their decisions and their behavior, get them to follow the doctor's advice, especially as value-based contracting comes to be. So we ended up leaving P&G in 2012 and starting C2B Solutions. And it was all basically taking what we knew about marketing and consumer understanding in healthcare and bringing that to the providers that are out in the U.S. marketplace. So it took off pretty quickly. There was a big demand for it, and did that for several years. During that time, we had a way of understanding the consumer and influencing their health behaviors, whether that's getting them to choose a doctor or maybe take their medicine and whatnot. But really, it was two guys in a truck. And it's really hard to scale a small operation like that. So we were looking for a digital partner, something that could actually take psychographic messaging and these consumer insights and blow it out to millions of people at once. And that's where we got involved with PatientBond. and we worked in partnership for the first 3-4 years. And it was kind of like Reese's peanut butter cups, right? It was like peanut butter and chocolate, put them together, and it worked really, really well. And it just made a whole lot of sense to just make it one company. So we ended up selling C2B solutions, as you said, in 2017 to PatientBond, and I'm here. I've been here since then.
Beautiful. Love the story. So we're thinking about the way the world was before COVID-19, and now we're thinking about the way the world is evolving. We realize that digital has broken through, and we've seen the times have been a bit of an accelerant for technological innovation and adoption. So tell us a little bit about the whirlwind or the momentum or the groundswell that you have leveraged since the COVID-19, not in a negative way, but in a positive way on the benefit of patients. Has there been any changes to the PatientBond solution and what it is that you provide to customers?
Yeah, great question. Actually, there have been some elements of digital health that have grown gangbusters. There are some other areas of digital health that might not have grown as fast as people had anticipated or had assumed, and in some cases, kind of counterintuitive. So, for instance, telehealth, obviously, that grew. Did it grow to the level that everybody thought it was going to? There isn't necessarily 100% adoption, and it hasn't replaced the in-person caregiving that happens. We did a lot of work with telehealth before COVID, but we actually, looking at the tea leaves, we ended up building our own digital health or kind of telehealth virtual care offering within PatientBond, right? And that's starting to take off too. But all along the way, we do a lot of market research to find out, what are people's attitudes? What are their values? What are their behaviors? And trying to anticipate what some of those dynamics are going to be. And we did some studies before COVID, during COVID, and we're doing it after COVID too, to say, okay, what kind of an impact has this had on digital health? And like I said, yeah, telehealth obviously grew. But, in the research that we did, measuring who was using telehealth before COVID and who was anticipating to use it during and after COVID, it looked like it was topping out at only about 30 or 40%. It's not the 100% people might have been assuming. And, there are different consumer types or patient types that are much more likely to use things like virtual care and telehealth versus some other patient types. We call those psychographic segments. So that there are some low-hanging fruit there, and then there's some laggards that are coming along. There's other aspects like remote monitoring, at-home diagnostics. Those are starting to take off a lot too. But health portals, digital apps, those didn't see a big rocket ship kind of hockey stick of adoption during and after COVID that people might have anticipated. So there's a lot of opportunity to drive digital health beyond where it just naturally fell after COVID started.
So maybe we can just take a step back, because in some ways people maybe need to have an understanding about what PatientBond actually does. Sure. What is the business model behind your company? Are you a market research company? What is it that you actually provide as a service or product? And ultimately, who is your core customer?
Okay. PatientBond, if you think of it as a platform for digital patient engagement or digital member engagement, if we're talking payers, or digital healthcare consumer engagement, if you're talking, say, retailers. So it uses a variety of digital channels, whether it's email, SMS text messaging, interactive voice response, in-app or portal messaging. But basically, depending on where there's a touch point that you can reach the healthcare consumer with a digital message, we can do that. And we focus on growing our customers' market share, improving health outcomes. And I'll get to this in a little bit, but even using what we do to drive collections and patient payments, it actually has been working really well. Now, what we do recognize, there's thousands of digital companies that are out there. Patient engagement, a lot of people are involved with that. There's an underlying model or an innovation to the communications that we do that does differentiate us in the marketplace. And it's basically what I used to do at Procter & Gamble for 20 years. And it's called psychographic segmentation. And what psychographics pertain to are people's attitudes, their values, their lifestyles, their personalities. it basically makes up who you are as a person, as a product of nature and nurture. And these aspects of you as a person are what really are the core to your intrinsic motivations and communication preferences. Okay. So what we can do is divide up a population into different psychographic segments. And each segment has a different way they approach health and wellness, and it has a different engagement strategy based on their healthcare personality. And what PatientBond then does is recognize that and changes that engagement, whether it's the word choice in the messaging, whether it's the channel mix. One channel, or say emails, might work better for this segment versus text messaging for another. The frequency and cadence of communications could be very different. So think of it as a platform of understanding you as an individual and taking kind of that healthcare personality into each of the individual workflows that go out there. And what it does is, by speaking to people based on who they are and what their individual preferences are, you can really enhance the outcomes of your efforts. The results are great. Now, that said, you had asked about who's our customer base. Typically, it's hospitals and health systems, physician groups, payers, both national and regional payers, and urgent care, of all things. I'll tell you, of all the different healthcare providers that are out there, urgent care, even if they are smaller relative to the big health systems and payers, they have a pretty good entrepreneurial hat on. They kind of understand retail marketing more so than some other aspects of healthcare. So when we come to the table with some of our solutions, the sales cycle with something like urgent care is a lot faster than, say, a big health system.
So let's just say, for example, I'm an urgent care customer.
Mm-hmm.
Tell us a little bit about what they're currently doing and what is going to change for them when they start working with PatientBond. What is that inflection point? So what is the current scenario, and what is it that you're going to do to help them change what they're currently doing?
Think of it as kind of extending their care and extending their relationship beyond the walls of the urgent care center. So you're actually a presence with the consumer or the patient throughout the year. If you think of urgent care, it's very acute. It's very event driven, and there isn't a lot of differentiation out in the urgent care marketplace. So when a person gets hurt and they need immediate care, they go to an urgent care center. Are they loyal to that urgent care center? If the next time they get sick with a cough, cold, or maybe want COVID testing or something, are they going to always go back to that one urgent care center? Well, they may or may not be top of mind. So where PatientBond then comes in, it helps the urgent care center recognize the entire patient journey and connect with that patient throughout the year. So they might have come in for that acute event, but you know what? There could be school physicals, there could be work physicals, there could be different screenings or wellness exams, there could be flu shots, things like that throughout the year. And what we do is reach out to their patients throughout the course of the year and remind them of what it is that the urgent care center can offer and why that urgent care center is different. And we frame that communication in such a way that it resonates with that individual because we're speaking to their psychographic profile.
So in some ways, you act almost like an extension of that urgent care facility. So instead of there being, I guess, a person, it's a series of messages given to them in the right frequency, cadence, and with the right tools or vehicles that sends that constant beat or the reminders or things that they need to be doing. So it's in some ways kind of like a marketing machine. Is there another way to look at that?
It is a great way of looking at that, especially for urgent care. Now, we're not a CRM system or a practice management system. We call this kind of a bolt-on or enhancement to what they're doing if they have their own CRM. It's not a true CRM, call it CRM Lite. But yeah, if for urgent care specifically, it's kind of a marketing system that allows them to send out those types of communications throughout the year. With bigger health systems, it goes beyond that because we do a lot of work in health outcomes, patient engagement for clinical reasons and things like that. But mainly for urgent care, yeah, it's a way of getting those feet back in the door, keeping them loyal and keeping them coming back.
Got it. Yeah, totally makes sense. So I'm an urgent care center. I've decided that I'm going to work with PatientBond, and I've got my database of patients. So there's communication ways of getting a hold of them. So how do you look at that patient base, and how do you start applying these psychographic segmentation to basically a nondescript set of people that you don't know, high or low, what any of their parameters or specifics are? How do you go in there and start parsing and delegating and segmenting so these people start receiving things in the way that they prefer?
Yeah, that's a great question across all of healthcare, but urgent care specifically, you're dealing with a patient base that doesn't have a lot of, they don't want to spend any more time at that urgent care center necessarily than they have to, so they can get fixed and get out. So the most accurate way of figuring out a person's segment is asking them a 12-question, minute-long survey that we have developed. But does an urgent care center have the luxury of doing that while they're sitting there sick or wanting to get treated? Probably not. But we can ask those questions after they've left, under the idea of, hey, look, thank you for coming in. We really want to make sure that in the future we tailor our our interactions with you in a way that really makes a difference for you. If you answer these 12 questions really quickly, a minute, we'll be able to individualize and personalize your experience from here on out. That's one way of doing it. Another way is, we work with what they call a national data compiler. You're probably more familiar with these types of companies because people have a credit score. These are the big companies that go out and buy up all this data from third-party data sources, whether they're like surveys or government information or whatnot, but they collect all this and put together records on everyone here in the United States. And they use that for figuring out what your credit is based off of, purchase history, payments, and things like that. Well, we work with one of those types of companies, and with our data scientists, we were able to create a statistical projection of these segments across the United States. And everybody over the age of 18, based on the records that exist, we actually do a statistical projection, and we can actually show an urgent care center where certain segments are over or underdeveloped in their geography. And if we do an overlay, we can do what's called an append, and we could take a patient database and append the patients in that database with their statistically assigned segment. And for urgent care specifically, it's really interesting. We've identified 5 psychographic segments. There could be 20, 50 segments, but really from a business practicality standpoint, juggling any more than 5 becomes kind of crazy for a marketer or a clinician. So we said it's 5. But one of those 5 segments account for 70% of those people that visit urgent care frequently. They also account for 2/3 of people that go to emergency rooms at least once a year. It's called that willful endure segment. And with that group, one of our big health system clients that have about 73 different urgent care locations, did a big analysis and showed that the number one variable across claims data, demographic, socioeconomic, the number one variable predicting the success or not so much success of an urgent care center was tied to whether or not there was an overdevelopment of this one psychographic segment within 5-mile radius of their urgent care center. So they use this now for real estate strategy too. So yeah, that's another way urgent care can use this kind of data. We can either get it down to the individual, or we can look in a geography and say, here's where you're over or underdeveloped. That's helpful for signage, billboards, publications in local publications, newspapers, things like that. So that helps with the marketing also. And then, we do digital communications, but another aspect of this is actually training both marketers, staff members, and clinicians on how to engage these segments one-on-one, whether it's in person or over the phone, because there's a whole set of words you want to use and words you want to stay away from when you're dealing with a psychographic segment. If you know what segment that is, and you're going to boost your likelihood of driving and activating those behaviors you're looking for.
So I'm just kind of curious, there's a database that they already have of people that have gone to their urgent care center, and then there's a whole universe of people that have not. Are these urgent centers also looking at psychographic data of the population in general and using PatientBond to proactively approach these individuals to sort of beckon them in or market to them to come into their center as well?
Yes, they're starting to now. Psychographics is a pretty new concept to health. It's been around since the 60s, and Procter and Gamble and Walmart and everybody's been using it forever. But in healthcare, it's fairly new, and in urgent care, it's really, really new. But they're now getting into that. And I'm working with a very prominent urgent care system right now where we looked at all of their markets. They had about 45 different markets. And we were able to see what was that psychographic distribution around a 5-mile radius for each one of their sites, and see who was over and who was underdeveloped. And we went from site to site and crafted a different strategy for those sites to be able to reach out to the community and say, come to our urgent care center because whatever their proposition would be formulated using segment-specific language and segment-specific imagery. And it could be on their website, it could be on traditional advertising, banner ads, things like that. But when you know you're going after a certain segment within a certain geography, you can engineer your messages so that you are really, really appealing to that one group that you really want to bring in.
Fantastic. Now, one of the things that's also important is, you're starting to put these messages out using various vehicles. You're applying this to the various, psychographic segments. Ultimately, the question that I think a lot of people are going to be asking is what are those psychographic segments? You were mentioning that there's 5 different ones. Maybe you can kind of explain at a high level what each of those are, and generally speaking, the percentages that we're going to see in the general US or North American population.
Sure. So there are 5. I'll start from like the most proactive with their healthcare and kind of get through the spectrum to the least proactive or maybe reactive. But the first one's called the self-achiever group. And the self-achievers are the most dedicated to their health and wellness, willing to invest whatever money is necessary to enhance themselves. So they do a lot of research. They try to eat well. They try to exercise. It's all about goals, achievement, winning. So they will look at a health issue and kind of consider that the enemy to be beaten. And it's kind of like the hero archetype, right? Go and overcome that. And this is a group that's a very type A kind of personality, and they've got lists that they need to work through during the day. And once you check something off, then something else comes onto that list. The thing about this group is also they kind of tend to put physicians and other healthcare professionals up on a pedestal. And they'll say, hey, look, if the doctor tells me I need to do this, I am going to go do it. That's important to remember because there's another group called the balance seekers who are almost as dedicated to their health and wellness. I mean, they're into nutrition and exercise and things like that. But they're all about options and choices and experimentation and discovery. And this is a group that's the most likely to try like alternative and natural medicines and stuff like that. And they're very independent. They don't typically go to the doctor unless they absolutely have to. So they're not high utilizers in the system, at least not till they're in their 40s or 50s overall. That group, though, if you look at the 5 segments, even though they're just as proactive in the way, on their terms, they're the least likely to say that a doctor is the most credible source of healthcare information. So if you're doing advertising to balance seekers, the last thing you're going to want to do is put a doctor front and center and say, I tell you to do this, because you're going to turn off that entire group. Now, that entire group is about 17% of the US population, and self-achievers are about 19%. So they're about the same size. Right in the middle, you've got a group called the priority jugglers. And this is the group that will invest anything in their family's care. They're going to make sure that their loved ones get all the care that they need. They're always looking out for their coworkers, their friends, and things like that. But they're very reactive for themselves. They're not investing in themselves because the idea of sacrifice is like sacrosanct to them. It's kind of like, I'm going to throw myself on the grenade to make sure everybody gets what they need. And my wellness is probably not top of mind. And they've got so many things that they're trying to juggle, and it's kind of a badge of honor. So they're extremely busy. I mean, we're all busy, but they actually prioritize that and say, hey, that's a badge of honor for me. And the way to get through to this group is to appeal to their sense of duty, to the sense of dedication. It's like, hey, look, there's so many people counting on you to be healthy that you don't want to let them down. So you need to do X, Y, and Z for your health. So it's kind of a guilt approach to that group that doesn't necessarily work with the other segments. The 4th segment's called the direction taker group. And it's about, priority juggers are 18% of the US. Direction takers are 15% of the United States. And don't let the name fool you. You know, when I say direction taker, people might picture some passive person, kind of a pushover, just sitting there waiting to be ordered around. They're not direction followers, the direction takers. And what that means is they look at the doctor as the most credible source of healthcare information. They prioritize institutional authority, and they say, look, you're being paid, if you're the doctor, the institution, the hospital, you're being paid to have all the answers. I'm an expert in other aspects of my life, but I'm trusting that you have the answers. So I'm not going to ask you a lot of questions, and don't ask me a lot of questions, because then I just assume that by virtue of that license on your wall, you know what you're doing until you prove me otherwise. So just give me the 1, 2, or 3 things that I need to do. Give me that direction, and I'll go about my day. But that, a lot of the healthcare system here in the US looks at us all as kind of that direction taker group. If the doctor says so, then we're all going to follow it, when in fact it's only about 15%. That means 85% of the people don't really like that approach. And then the last group is actually the biggest group, and I'll call them the least engaged, maybe even a little bit disengaged with their healthcare. They're called the willful endurers, and it's 31% of the US population. They can will themselves through anything and endure any pain. Basically, they're highly independent. They live for the moment. They don't necessarily invest in their health and wellness. What they'll do is they'll say, hey, look, you know what? I've made it this far. I'm not going to worry about my health 10 years from now, because when I get to that bridge, I'll cross it. I'm okay now. Let's live for the moment. So with this group, you've got to be able to formulate a benefit that's of immediate gratification. They don't like to wait in line. This is why this group are frequent flyers to the ER or use urgent care or retail clinics quite a bit. And you've got to make it very simple for them, hassle-free. Give them 1 or 2 points and have them on their way, but help them understand that by taking action now, you're going to get the benefits that you need.
I'm very interested with this psychographic data. If you believe that there's any modifications to the percentages or any of the impact because of COVID-19, I'm just curious about your perspective on these different categorizations or segments, how people and how this has affected everything from testing to vaccinations.
This is great. We're, in fact, we did a whole study on COVID last July 2020, to figure out how the segments were going to react with what was going on. And this week, actually, we are fielding a 5,000 respondent study across the US on COVID vaccination. I've got my hypotheses about how the different segments are going to react to the COVID vaccination. Based on everything I've done, for the last 28 years between PatientBond C2B and P&G. But let the data tell you. I will say, prior to COVID, 2 of the segments were the anti-vaxxers, the balance seekers and the willful endurers, for very different reasons, the different motivations. But of the 5 segments, those were the 2 that actually stood out as I don't necessarily trust vaccinations at all. Now, the balance seeker, typically they like information. They do a lot of research. And if you can provide the right type of information to them, or help them find that information on their own by giving them some guidance and navigation, if you give them the right information and data, they will actually change their mind, because you're overcoming what they, in their own personal experience, that they believe. But they'll look at it logically, because they're kind of a skeptical group, but skepticism can be overcome with proof. The willful endurer group is more about suspicion. It's more emotionally driven with this. So it's a little bit harder and more challenging with that group. Now, prior to COVID, those were the 2 groups that were less likely to get the vaccination. Now, will a pandemic as serious as COVID change all of these segments and make even the balance seekers and the willful endurers want to get a vaccination? I would put bets on the fact that you're probably going to see some of the same attitudes and approaches to the COVID vaccination as we saw to vaccinations in general among those 2 segments, because the segments are who you are as a person. They're your personality. COVID came out, and people are concerned with it, but does it change your personality? Did you have a personality flip? Did you change every priority in your life around it? Or did you adapt your behaviors based off of how you are programmed, how your personality is? You can learn behaviors. You don't necessarily change your personality, and then adapt accordingly. The other thing is, though, I'll say that we're actually made up of all 5 segments, kind of like Myers-Briggs in a way, if you're familiar with Myers-Briggs and all the 16 different types and stuff like that. Actually, both models have an underlying tie to Carl Jung and archetypes and stuff like that, but I won't get into that just yet. But so because you're made up of all 5 segments, and full disclosure, I'm 75% balance seeker, 15% priority juggler, 10% self-achiever, and some fractional percentage of willful endurers and direction takers. If you're a fence sitter between 2 of them, say you're 51% priority juggler and 49% willful endurer, there could be a wake-up call that kind of pushes you over and says, okay, now I'm going to be focused more on my secondary preference, which is that willful endurer. But there's, out of the entire population, there's only about 10 to 15% of people that are that kind of a fence sitter. Most people fall in the middle of the bell of, of the segment distribution. And, I might go from 75% balance seeker to 70%, but I'm still a balance seeker. In fact, I might fall from 75 down to 51. But my primary preferences are balance seeker preferences. So the way you'd engage me would be that way accordingly. Now, does the distribution change? The distribution does change depending on population. So we see the distribution of the 5 segments change in different geographies, like the Southeast, the Northwest, the Northeast, the Midwest, in different groups. Like when we're looking at social determinants of health, and if there might be some underserved populations, you will see some differences in the distribution of those segments, but those same 5 segments occur everywhere. And we pressure test this model every time we do a national study, which typically is every year or 2. We're doing 2 within 6 months now, just because of what's going on in the environment. Our customers want to know about this stuff. And the model is held very, very stable throughout all of it, including with COVID. We have not seen a big major change between any of the segments relative to each other or relative to the general population.
I'm actually curious as well, Brent, if a big hospital institution was to approach PatientBond and said, one of the things that we're trying to measure or we're trying to achieve is a certain number of people coming to our institution or institutions for vaccinations. What advice would PatientBond give to that group on the most optimal way of marketing the vaccine based on this psychographic data analysis?
Great question. You know what? I'm going to have an even more educated and better answer for you next week. Not that helps us on this webinar, on this fireside chat, mainly because one of the things that we recognize is there are ways of positioning your proposition that is consistently will work with each one of the segments, like priority jugglers. Hey, position it as you want to do this because your family's counting on you. Whereas with a self-achiever, hey, do this and you're going to get an enhanced lifestyle and you're going to be much better. You're going to be improved and you're going to conquer the COVID virus and all this kind of stuff. So there's some general things there, but the thing you got to recognize is there's going to be a bunch of holdouts that don't get the COVID vaccination right out the gate. And the feedback we've been getting from our big hospital clients are, you know what, we have our COVID vaccination strategies in place and have been starting to execute that now. What we tell them is, like, we know, for one, absolutely, there's going to be some early adopters, and you're going to get some people that are going to naturally be the first ones in line to show up for that vaccination. But Ipsos worldwide, big market research firm that we actually work with to field all of our studies, did a global COVID vaccination study. And what they found is about 60 to 62% of people indicate they'll get the COVID vaccination over the course of a year. So the hospitals and health systems then are going to get that low-hanging fruit and then hit a wall. And we'll call that phase 2. This is why we're doing this big study now, where we can give some general feedback on how to position your proposition and reach out to the different patients to say, this is why you want to get it. But this big study that we're doing, and it's fielding this week, goes to very specific questions around, okay, you indicate you're not going to get the COVID vaccine. Here's a litany of different things that might convince you. Which of these do you want to see? What is necessary to get you over that hump? And, it could be science. It could be a publication. It could be someone's friend or family member that recommends it. It could be a celebrity. It could be anything, right? I can form hypotheses about it, but we wanted to get the actual real world data on that. We're going to get all that data starting next week. And I'm happy to share that with you and anybody that's interested.
I'm also curious to see if anybody is planning to collect that kind of information at the point of care. So for example, if there's an app or some other system that the actual vaccinator could potentially ask the patient a question about why they're there, because they could have changed their mind halfway between walking to the clinic, or what is it that spurred them that at the spur of the moment of why they did it. So it'd be very interesting to see if anybody's collecting it at the point of contact.
It would be, and you actually gave me a business idea. Well,
there you go. That's what we're here for.
Yeah, I mean, we've got we've got our own virtual health platform and digital health tools, and we work with pharma companies and hospitals on apps and stuff like that. And so far, I've not heard of anybody doing that right at the point of service and collecting that information. That's a very interesting feature, functionality that we might want to incorporate on some of the stuff that we're doing.
Absolutely, for sure. We're full of ideas like that at Impetus. So I guess the other thing as well too is just taking this or leveraging this as a general healthcare issue. We hear all the time of YOLO, so you only live once, and FOMO, which is fear of missing out. And so this might actually fall a little bit more in the willful endures, as you only live once and that sort of thing. And how does this apply to some of the more chronic health conditions that all healthcare institutions, urgent care centers, and everything else, insurance companies have to deal with? And that is people who have these, autoimmune diseases, people who have heart diseases, metabolic syndrome, all of the things associated with that, heart, diabetes, etc., arthritis. What do you do with people who say, oh, well, I'm just going to eat this, or I'm just going to do this because you only live once? I mean, how can PatientBond work with some of these organizations to move the needle on some of these people's behavior? So can you, in effect, change people psychographically, maybe, if not psychographically, behaviorally?
Behaviorally, yes. Psychographically, no. And that's something I want to point out really quick. And we can circle back on this too. One of the things why I believe this works very well is we're not out to change people's motivations. We're out to actually respect their motivations and leverage those motivations to get them to do the right behaviors, like eating right, exercises, and stuff like that. So it shouldn't at all be about manipulation. Don't want to do that. But how do you use that with someone like a willful endurer? You're right, dead on. It's the willful endurer group that has that YOLO kind of approach to life and fear of missing out. Yeah, loss avoidance can be stronger than incremental gain for a lot of people. I'll give you an example of someone we're working with, and I can name them because they're actually in the lay press around the work that they're doing with psychographics. And if anybody wants to look them up, they're TriHealth in Cincinnati, Ohio, a big health system that's out here. And we've been working with their health coaches and training them on how to interact with different patients for things like lifestyle modification, diabetes, musculoskeletal issues, all the ones that you were naming, cardiovascular events. And once they understand which segment a person falls into, it does a few things. One, it helps them anticipate what some of those objections are going to be. So if somebody shows up as a willful endurer, I know they're going to be more likely to have one of these kind of like fear of missing out, or you only live once type approaches. So you can head that off at the pass and start objection handling in willful endurer language. So the one thing that a lot of places do, especially if you're dealing with chronic diseases, a big mistake with a willful endurer is to say, hey, you know what? We have this 12-week program, or we have this 4-month program, or throughout the year, we're going to do X, Y, or Z. At that point, the willful endurer shuts down. They don't care, because you know what? That's 10 lifetimes from now. I only care about the here and now. So with a willful endurer, we say, don't talk about the whole program. Don't talk about the whole plan. Focus on the first step. It's only about the first step, and focus on getting them to take that first step and say, hey, look, we get to that first step. And if you don't like what's going on, you don't have to. You don't have to follow through on it. But let's make that call after that first, and the first step might be a couple days from now. It could be tomorrow. It could be the end of the week or whatever. And that first step might be as simple as filling out a health risk assessment, or maybe it's a first class or something like that they might attend. But leave the judgment for after that first step. There's something that motivational interviewing does. Bruce Berger, who invented that. We've had a lot of talks with him in the past. We worked with him while he was at Procter & Gamble, as a matter of fact. But he has a really interesting tool in motivational interviewing that I think is very specifically works for willful endurers. And it's this. Hey, on a scale from 1 to 5, 5 being the best and 1 being the least, how do you think you did? We asked you to do X, Y, or Z. Did you score a 5 or did you score a 1? And if the person comes back and says, well, I think I did a 3. With a willful endurer, what you don't want to say is, oh, that, good, but what's it going to take to get to 4? What you say is 3. That's fantastic. That's much. I thought you were going to say 1 or maybe 2. Walk me through what you did to get as high as 3, because that's fantastic. And they'll feed back to you what some of those habits and practices might have been. And you say, okay, let's isolate that. Okay, let's strengthen that even more. And let's put that into practice, and let's just focus there. You get to the next week, they come back in and you talk about it. And then you start saying, look, because one thing about willful endurers is they're very loyal people. They're the hardest people to convert to your product or service or your brand or whatever you're trying to sell. But once they're there, they are your best friend to the end. So you can work with them and say, look, I'm proud of you. I need you to tell other people just like you. And I have a lot of patients that are just like you, because they feel like they might be alone and out on a limb. No, there's a lot of people like you, and I think you can help them. Once you start validating them, showing them respect, and only focusing on the first step, that's key for that group. Now, that's easier said than done if you're in verbal communications, or if you're a health coach. If you're sending out communications, like say you're trying to get them after they've had a cardiac event and they've been discharged from the hospital, and you don't need them coming back within the first 30 days for 30-day readmission. Don't show them or tell them, here are the 12 different things that we're going to talk about over the course of the next 30 days. Focus them on the very first communication that comes out, and then let them know, hey, we're probably going to be back in contact with you. But focus them on the here and now, not the long term.
I love it. And there's so many great nuggets in this. I'm a big fan of somebody named James Clear, who wrote a book called Atomic Habits. And it's these 1% incremental changes that we do on a day-to-day basis, moving in the direction of what you want to do, compounded over time, brings us to what we want. And so the idea here is really, sometimes we don't feel motivated to do things, but we have to sometimes institute what we call behavior activation. And that is pushing you to do that 1% until such point that you engage in the dopamine system internally, and that you're sort of self-intrinsically motivated. You have to create that level of automaticity. So it's really around behavioral dynamics, which is really interesting.
And that's so it. You're not changing the person's personality. You're not changing who they are or what they prioritize. You're changing behaviors and help them understand the successes that they have over time.
So one of the other elements behind behavior, one of them, is sort of the age-old issue that we run into all the time, is around adherence. Somebody asked a question here about different kinds of devices, tools, apps, wearables. There's one that's an FDA-cleared ID cap, a company called EtceteraRx, to monitor things like ingestion of the oral capsules, and tablets to monitor adherence. Of course, we know about the Apple smartwatch and Fitbits and all kinds of other things. Is there opportunities for PatientBond to be integrating with these other sorts of things to kind of assist with behavioral changes?
Yes, absolutely. In fact, the platform technology allows us to connect with, we'll call it remote monitoring, device communications, and things like that. What talking about the work that we've done with the market research. Again, all that market research that we do goes to inform the communications that we send out as PatientBond, right? We did not see a massive jump in app utilization happening after COVID, but certain segments are more likely to be using those types of devices. Now, how do you get all 5 segments to use it more? You can expect bigger jumps from some and those incremental from other, but you have to help them understand what's the value proposition. How do you frame that value proposition so they know what's in it for me, or the WIFFM or whatever that radio station's called, right? um, you got to keep that in mind. Just to say, hey, put on this device and we're going to monitor you. Okay, a self-achiever is going to look at that and say, well, this is fantastic. That's data that I can use, and I trust my doctor to take, to use that information and help inform my plan. Because as a self-achiever, my kryptonite is not having a plan in place and not having a regimen. The willful endurer will look at that and say, device, what do you do? Clamping something to me and you're spying on me this whole time? No way. Click, throw. they're not going to do. And then the balance seeker, unless you can give information or proof, context that doing such a certain behavior is going to lead to incremental benefit, they're probably not going to take action either. But if you can show them the proof and the data that shows that you're going to move from point A to point B and it's good for you, well, then they may adopt it. But you've got to be able to formulate and frame your proposition in a way that's going to help that person understand why I'm doing that. And then, reminders. Everybody benefits from reminders on an ongoing basis, but those reminders also need to be worded in a way that resonate with a person's individual motivations and priorities. And that is what PatientBond does. We are working with some organizations that tie to certain devices.
So this is really interesting because this is all tying into the N=1. So the uber precision medicine, the uber, this is the patient with their own unique journey and their own unique messages and all these sorts of things. How do we get there from a population health management standpoint? How do we get into the drill down of this patient is going to get this? Do you use and leverage artificial intelligence to learn how each individual is doing things? Or is there another mechanism that you're using?
Yeah, no, actually, this is becoming a very important part of what we do, mainly because healthcare there's an ocean of data that's out there, whether it's utilization data, claims data, all the demographic, socioeconomic data and whatnot. We're using the machine learning right now to go through our market research that we have coming in and help us hone what our propositions are and what our communications are to the different psychographic segments. And in fact, we're building the capability to allow us to take all the content that we've sent out, look at what segments people are, and really be able to analyze really quickly. What are the words? I know what the words are to use and lose and what the concepts are and things like that, but I'm only human and I'm one person. But the machine learnings allow us to go into the millions of data points and really isolate what are the words, what are the images, what's the layout, what are the calls to action that work the best with each one of the segments. And that's kind of like PatientBond version 2 that's going to be coming out. But we're actually using machine learning right now to hone even the surveys that we ask to figure out which segment a person is in. So as I said before, we have a 12-question survey and it's 92% accurate as to which segment you fall into or what's your primary segment. But looking at all of the data that we've got now, we can actually get that down to 7 questions and it's about 80% accurate. We can get it down to 4 questions. Who can't answer 4 questions? And it's about 70% accurate. So as we do more research, we try to bump that 70 back up to 80. And is there a combination of 5 or 6 or 4 questions that we can ask that get us up to that 92 that we have right now? You can't do that without the pretty good quant computing power that's going on. So we're in the middle of that now. I would look to see using artificial intelligence, the machine learning that we're employing right now to be able to automate this. And if I'm a marketer, say at a hospital system or at a payer or an urgent care center. And I know that I want to go after, say, that willful endurer group that's out there. And I know that by using the right words and imagery and the right digital advertising and banner ads and the words on my website and all that, what really has worked with willful endurers, down to that really specific science. It's a matter of pushing a button and automates all executions that go out. It takes the thinking out of it, makes it highly efficient, and it's all based off of what has worked in the past. We're doing a lot of that kind of manually right now, but evolving that using the machine learning. And really, there, like I said, there's so much data that can be used out there. It's not just psychographics. Think of psychographics as a consumer lens to help you interpret how the patient sees the world with all of that ocean of data behind you, and not making any kind of assumptions about what the patient's thinking at that one-on-one level, because we all have our biases. Like I said, I'm a balance seeker. I also came out of Procter & Gamble for 20 years, and the biggest wake-up call I had is the rest of the world doesn't think the way a P&G person thinks in their biodome with their country club of functions and support teams and stuff like that. So you've got to step outside your own shoes and see the world through the eyes of the individual. And machine learning and AI is allowing us to comb through more and more data to be able to formulate that. And it's really a strong part of operationalizing psychographic segmentation. For the longest time, psychographics helped inform what we'd call like just a prime prospect. You know, you go into a brand cube at P&G, and they had the persona that they were going after, you know, a big cardboard cutout of the target consumer with kind of a description of socioeconomic and demographic variables. And here's the one psychographic segment we want. It isn't until recently, with all the machine learning and all the digital communications and all the different tools that we've got now, that you can actually operationalize this across a giant population and get it down to that individual and target people according to their psychographic profile and deliver psychographically infused communications. And that's what PatientBond is all about. It's the digital platform to be able to deliver psychographics.
It's brilliant. And you know, you think about the seamlessness of how things could also work in the future. We're talking right now about filling out surveys, but what about this opportunity around interoperability, including these things already on electronic health records, potentially using things like biometric, basically seamless biometric data flow. So, you know, as you're using your keyboard, things reading you or watching you or whatever. But it also brings up this question of seamless integration. So sentient kind of biometric data flow, but then there's this question about these data lakes and data security and data ownership. Mm-hmm. How does this all come into play as we look at this whole ecosystem that you're working in?
Yeah, you know, sometimes the technology itself is the easy part, right? I mean, a series of API calls can connect all of these different things, and everything resides on an AWS cloud and all that. So when it comes down to what's ethically right, that sometimes that becomes the challenge and legally right with, you know, high tech and HIPAA and all that kind of stuff. The hard part is not making those linkages. And the hard part isn't necessarily using the AI or the machine learning to figure out, okay, I've got all this biometric data. I've got all of this consumer data. I've got all of these claims data coming together with a recipe for what we need to do. Can we identify, say, a psychographic segment by using biometric data and stuff like that? I think we can to a great degree. For instance, back in the day, our current model is actually what I'll call a fourth generation psychographic model built on 3 generations that I built at Procter & Gamble. One of those models actually we overlaid with what was the precursor to Optum. So United Healthcare's claims data and analytics ability. It was called Ingenix back in the day. I'm really dating myself here. But what we found was there were disease incidences and medication adherence differences among each of the, what I'll call the grandparents of the current psychographic model. So you can look at all that data and say, yeah, you know what, there is a difference in incidence of cardiovascular conditions with these 2 segments, and maybe depression and anxiety with these 2 segments. All right, that becomes a little big brother. making sure that people understand you got the opt-in, opt-out, being very transparent about how this information is being used. If you're asking patients to answer a 12-question survey to figure out what their psychographic profile is, we're not telling them psychographic profiles or even what their segment name is, but it's like, hey, look, we want to understand what's your learning style, your healthcare learning style. What are your preferences of communication? Because we can personalize and customize your healthcare user experience, for lack of a better way of putting it, to meet your specific needs. Now, if you opt out, you opt out. You have to do that. And you can't, one of the things that kind of separates us from some of the more questionable things that have happened in the past. I mean, everybody's familiar with how, real-time behavioral data through social media and stuff was used to influence elections, back in 2016 and now and whatnot, and Cambridge Analytica and all that's out there. We tend to stay away from real-time behavioral data to monitor people, to see what they're doing for us to trigger an event. We rely on the psychographic model, which comes down to who you are as that person. That doesn't necessarily change over time, and model everything that we deliver based on your preferences. And that way, we're not being a big brother, and you have to articulate to that end user, that consumer, that patient, what you're doing. And if they say, look, I don't care, I don't want that, well, we give them that avenue to get out. Opt-in and opt-out is a very strong part of what we do.
We deal a lot with pharma companies. I'm just curious. I know that you deal a lot with, insurers and institutional levels, urgent care, whatever. How could pharma partner with PatientBond, and what would be the benefits of them doing so?
Yep. We actually have a couple clients that are pharma and specialty pharma. So and they've got their patient engagement efforts. They've got their apps and things like that. What we're doing with those different groups is helping them understand that patient experience with their drug or their medication, with their app, with their interactions on the website, based on their psychographic segment. Here's how you need to tell them or suggest that they take their medication. Here's what's in it for them. Here's the benefits, reminding them of different lifestyle modifications that they probably have to do to maximize the impact of the medication that they're taking, but do it in a gentle way and do it in a way that resonates with their personalities using those psychographic insights. And we have actually seen increases in medication adherence sustained over time by, go figure, treating people like people and talking to them the way they want to be talked to.
That is fantastic. And just as we're hitting the top of the hour, I'd be remiss, since we are based in Canada, our headquarters is in Canada. We understand that you helped to develop a Canadian COVID-19 alert app. Is that true? And what role did you play in creating it?
I personally did not have that connection there, but we are working with some clients that are up in Canada now, with some pharmaceutical companies going across the world. What I will say was, with a COVID app that would be rolling out in Canada, if you look at some of the numbers that are at play, I had quoted some of the numbers for app utilization here in the U.S., and it's about a half to 2/3 of people don't regularly use a health app. And there isn't one health and fitness app, that gets more than 10% utilization of any one of our segments. So the whole adage of build it and they will come doesn't work unless you're able to help frame the proposition for that app. And that in the Canadian COVID app, I was looking at some of the numbers the other day on that. And again, I say I haven't personally been involved. Doesn't mean that we as a company haven't been, but I don't believe the psychographics is actually injected into the Canadian COVID app. But I think the utilization of that app is about 16%. I think it was about 6 or 9 million, somewhere between 6 and 9 million Canadians have downloaded and started using that out of the total population. So actually the utilization of it mirrors pretty well some of the more popular health apps here in the US, but there's still, that means 84% are not using it. So can you formulate that proposition in a way that gets more and more people to use it? And again, and this is where I step away from necessarily psychographics and things like that, and use my marketing hat. You have early adopters, fast followers, all the way to the laggards. Identify who in the marketplace are going to be some of those early adopters and fast followers. Cultivate them as ambassadors for everybody else, and use that kind of information to get others to use it, because they're going to trust peers and whatnot. The Canadian market's a lot different than the US market in terms of mass data, allowable mass data utilization and things like that. So when I say I work with a group that knows people's credit scores, that is strictly United States. that is not up in Canada. There's different ways though, and we have looked at some of the psychographic distribution up there, and that's where you can take maybe a better one size fits all and say one of the 5 segments is overdeveloped. Let's start with messaging there, and let's focus there, and then get a big uptick there, and try to bump up that 16% utilization to 20 to 25 to 30.
Yeah, we really realize that as well too. Although we're headquartered in Canada, we work across the globe with a lot of US clients, and we obviously know the big difference. So this was an outstanding conversation. I love what PatientBond is doing. For those of you who are listening to this show afterwards, we're going to be leaving the connection points to meet with Brent if you're interested in partnering or discussing or seeing how you might be able to use his services. So check that out in the show notes. We also encourage you to check out impetusdigital.com. If you're interested in these kinds of provocative discussions, having these with stakeholders or your customers, talking about beyond the pill, what else can you do, strategies, tactics, doing a series of touch points, asynchronously or synchronously, or even just doing any of your corporate meetings, check out our platform. We do this for a lot of people. So thank you for all your time, everybody. Appreciate you. Please actually subscribe and share so that other people can find our information as well. Thank you, Brent. It was an absolute pleasure, and wishing everybody a great day ahead.
Thank you, Natalie.